A Colorado mom and dad are sharing an incredible story of trying to negotiate their way through their health insurance system. Their 6-year-old son has a life-threatening medical condition, and in trying to get help for him, they have been advised to do a lot of things, including contemplating a divorce so that they could qualify for Medicaid. Meet the Wilkes family. Little Thomas, seen in the middle of the picture with his red shirt, has severe hemophilia, and he requires very expensive care, almost $1 million a year. Thomas's dad, Nathan, shared his powerful story while introducing President Obama at Saturday's town hall in Grand Junction, Colorado.
Neither I nor my family has ever been uninsured. Let me repeat, we've never been without insurance. Yet despite this fact, we've faced numerous struggles because of the cost of our health care.
Joining me now from Denver, Nathan and Sonji Wilkes. Thank you both for being on today and for telling your story.
Thank you.
Nathan, I watched you as you introduced the president, and as a physician who's really, I think, has seen this from both sides, I thought one of the most spectacular things about your story was that you're not the poster child that most people think represents the people struggling with health insurance in this country. Give us a little bit of insight about how you got here, the struggles you've had, and why this is important for you.
Well, basically, we started out, like I said in the speech, we started out with excellent insurance, and we've always had insurance. It just happens that when you have health care costs that exceed what an insurance company is willing to pay, they start playing games and forcing you into, backing you into a corner. They put a cap on our plan that was really forced him off the plan, and we had to go to the state high-risk pool. That had a cap, too, so we were forced to do things that most normal people wouldn't even consider doing. Even many social workers telling us, like you said, that we should get a divorce.
And I want to underscore, you always had health insurance. When your son got sick, you were already insured, and you worked very hard to play by the rules of the system.
Absolutely, and the tragic thing is that the condition for us was very easy to deal with. The worst part, the hardest part, was fighting to make sure that he could get the medication he needed, that we would be able to continue coverage, and everybody that I worked with had to face rising premiums, rising deductibles. It was really hard on everybody I worked with as well.
Sonji, when you were advised to contemplate a divorce, did you think about it very long?
No, not at all. That's just not something that even crossed our mind. Nathan and I are high school sweethearts. We're soulmates, and we're here for our kids. A divorce is not an option for us.
How's your son doing?
He's doing fantastic right now, but that's thanks in large part due to the excellent medical care that we receive. Our doctors and nurses are fabulous. We have no issue with them. They think outside the box and really get him what he needs. So he's doing quite well.
Nathan, what's your current status of employment, and what do you want to see changed?
Right now, I am basically self-employed. We had to start a company just to get to a point where we had control over a plan. Fortunately, in Colorado, we have some legislation that just passed that prevents the insurance companies from charging us exorbitant rates as a small company. But that's where we are. We're stuck there. There's a lot of life plans that we had, basically, that are now put on hold, and we're just hoping that something is passed that holds the insurance companies accountable, that gives small employers a choice as well.
But I think what you said was very important. You had to change how you were employed in order to get the appropriate insurance that would fit your family.
Absolutely. And for most people that I run across that have issues, we were lucky. We worked with several people that were able to help us get there. But most people I find, especially the small business, the self-employed, don't have the protections, don't have the security that we were ultimately able to find.
Sonji and Nathan Wilkes, ladies and gentlemen, this is the face of the underinsured people who get caught in the snares of this messy system we have. Thank you to both of you for joining us today.
Thank you.
I very much
appreciate
it. Very important to get the facts straight.